about the situation today, and then we will go to questions from each of you, and I will moderate the questions, so I'll call on you when it's your turn. Okay, so I'll turn it over now to Dr. Wang.
Thank you for joining us quickly. So this morning, we received notification of a death of an individual at St. Mary's General Hospital. This is the first confirmed death related to COVID-19 in the region. The individual was a male in his 40s with underlying medical conditions. In order to protect privacy, we will not be releasing further specifics regarding this case. This is a very sad event, especially for the family and loved ones of the man who passed away. I wish to express my deepest condolences to his family and loved ones. We recognize this is a stressful time for residents. We need to continue to work together to further slow the spread of infection. Although groups such as older adults and those with pre-existing medical conditions are at greater risk, no one is immune to the development of infection, nor the possibility of serious complications and death. All residents who are not performing essential or critical services in our community are asked to stay at home, avoid any non-essential trips, and keep 2 meters between themselves and others whenever they need to leave their homes. COVID-19 should not be treated lightly. By working together and adhering to this advice, which we understand is not necessarily easy for all of us, but important. By working together, we can help reduce the spread of COVID-19. That was all for what I wanted to say.
Okay, thank you, Dr. Wang. We will get started with 570. You can go ahead and unmute.
Thank you. Dr. Wang, when I go out and about, I see an awful lot of people out there. I know a lot of people are doing the best they can. Are we doing enough?
Yeah, I think, you know, it's been more out there that now we don't want people to gather. We want people to take precautions. I think the message is getting out there and people are changing their behavior. We will continue to reinforce that.
I know that you do not want to give specifics about pre-existing conditions, but it seems to me that this can lead to a lot of confusion. The pre-existing conditions in someone who's in their 70s can be considerably different from somebody in their 40s. Doesn't that lead to some level of confusion amongst people?
No, thank you for your question. Is this Brian, by the way?
Yes, it is.
Okay, thank you for the question, Brian. So it just means that someone has health conditions. You know, and like you said, people in their 70s or in their 40s or even younger can have other health conditions. It just means that, and that's what we mean whenever we speak of pre-existing health conditions or other health conditions.
Thank you, Dr. Wang.
Thank you.
Any other questions, Brian? Okay, we'll move on to Catherine Thompson from The Record. Go ahead, Catherine, and unmute your mic.
Okay, thank you. Dr. Wang, I just wonder, does this change anything, the fact that we have a death now in our community?
No, it doesn't. We were expecting to have deaths. In fact, I was a little surprised we hadn't had so far because we've had over 100 cases. That said, you know, we don't ever want to see them. But no, I think it just highlights, it's what's expected when we have cases. There will be a small number of deaths. Well, we'll have to see depending on the number of cases, right? There'll be a proportionate number of deaths potentially. It doesn't change what we have to do. The most important thing for us to do is to continue to practice those physical distancing measures And if people start to become symptomatic with respiratory symptoms, they should immediately remove themselves from the presence of others and go home and self-isolate there.
Okay. I'm just wondering with regard to staff people that have been working with this patient who has now passed away, what sort of measures are in place for them? I'm assuming there would have been a fair number of people who have come in contact with him since he was in hospital with the diagnosis for at least 10 days, I think. Was he not?
Yeah, I won't confirm specifics about, you know, dates of hospitalization and things like that, but you know, I do know that the staff at St. Mary's, you know, they put in place the appropriate precautions for people who are either confirmed or suspected to be COVID positive. So you may have to ask the hospital for more specifics in terms of their procedures, but those precautions are put in place and would have been put in place since the person came into hospital.
Okay. I'm just wondering, kind of piggybacking on Brian's question, I too see a fair number of people out and about. I see people shopping in pairs. I see people just picking up a few items at the store. I'm just wondering, do you think you need a stronger language? In the last couple of briefings, you've said people should not go out unless they feel they have to. You know, different people may have different interpretations about what they feel they have to. I'm just wondering if you feel you need stronger language to prevent the spread of this virus.
No, I think it's a very good question that you and Brian posed. And I think we have to continue to reinforce what we've been saying in the last couple of days in particular. You know, as you may know, the province Saturday night lowered their provincial order with respect to gatherings and lowered it from 50 down to 5, except for, you know, immediate family members and funerals and things like that. So, you know, it's another thing that has been done to really make people understand that as much as possible, they should not be going out if they don't have to. And if they do go out, they need to practice physical distancing as much as possible. You know, people do have their free will, but there are certain things like what the provincial order covers that are no longer, you know, legal, so to speak. So we need to continue to reinforce that messaging, certainly.
At what point would you step things up to more strict enforcement?
Yeah, I think, you know, that's a question that I continue to always assess. My sense is that, you know, it's important that it's not really possible, for example, for me to be sure when someone is going out for essential reasons or not. But I believe for the most part, many people, the vast majority likely, are actually heeding this advice and are actually really limiting the number of times that they need to go out. And so not everybody will heed this advice, but I really trust in our community that they will, and they will continue to, that they will heed this advice and they will continue to more and more heed this advice. It's really important. I can't stress enough that it's very important what each and all of us do, because how this will evolve in our community is a function of how each and all of us will act in the coming days. And so, yeah, I just really want to stress again that it's really important for people not to go out unless it's absolutely necessary. And when they do go out, to practice physical distancing.
Right. I'm just wondering, we've seen in other jurisdictions, limits like, you cannot go further than a kilometer from your home or a certain number of meters from your home. You can only go out once a week. You must wear gloves and mask. In Spain, they're expecting people, are those kind of measures? Why do we not have those in place here?
Hell, those are not measures that are currently in place in Ontario. And I do think that for those types of very broad measures, it is something that we would look to the province to decide on, because this is happening across Ontario. And so that would be something that we would look to the province to decide on.
That's it for my questions. Thank you.
Thanks, Catherine. Okay, Irene from Air News.
Hello, I have two questions. How did the person who died contract COVID-19?
Okay, so in this case, we do not have a direct link with travel or to another case. And so we consider this case to have been community acquired.
Okay, that's great. Waterloo Region is a large municipality. In an effort to reduce stress or panic, shouldn't the public be provided with some information, even if it is broad, about where the person was living before they went into the hospital?
Okay, so what public health does, thanks for your question, Irene. So just to provide a little bit of explanation, what public health does when they're informed of a case is they follow up to learn more information about the case, and they also follow up to identify people we consider close contacts. And then, there could be other people that are more casual contacts of the case. So for example, the case was working in a workplace, or the case was in another setting where there were other people, but not people we would consider to have been in close contact. Given the broad community transmission that is occurring in Waterloo Region now across the region, there is no, it is across the region. There are no specific, outside of those people that are close contacts to the specific case, which public health follows up on. There is no increased, there is no setting really in Waterloo Region that would make sense to identify as having been a bigger risk for the general population, because everywhere across the region is a potential area of risk. So I hope that provides some information. So we do follow up with the close contacts. We identify those and we follow up directly with them. But everyone else who may have had casual contact with the case, their exposure to the case is not putting them at more risk than them simply being out in the community.
Okay, thank you. I guess that does provide some sort of answer, but again, I look at North Dumfries. We don't know what the situation is in North Dumfries. I can walk across the road in Ayr and I'm in Brant County. So, not knowing the density, it just leaves a lot of questions. So, yeah. But I guess you're saying, from what you're saying, it is in every municipality in Waterloo Region.
It is. I mean, one of the things, Irene, we've done in Waterloo Region is we've done a lot of initial testing. Like, we have more prioritization now for the testing. But in the initial phases of this situation, we did a lot of testing, and so we're getting back a lot of the results, which is why we have, so many people who are tested in the region. But given what's happening across Ontario, I would consider there to be community transmission across Ontario and not just in Waterloo Region. But in Waterloo Region, we have a lot of data that allows us to say, yes, there's community transmission and that it's broad across the region. But if you're wondering about just neighboring municipalities, I would say you should consider transmission across Ontario is occurring, even if they don't have that many cases.
Okay, all right. I think because, like I said, I'm sitting in North Dumfries, we
Yes.
don't think there are any cases here.
Yes.
So,
Yes, and and even if you don't have cases, it doesn't mean that there isn't transmission that's occurring. And so I would my advice to everyone in the region is to consider that community transmission is occurring across the region, and everyone should monitor themselves for the development of respiratory symptoms like fever, cough, difficulty breathing, runny nose, sore throat. And if they develop those symptoms, they should self-isolate at home. And if they think they need medical assessment, they should call their healthcare practitioner or telehealth for medical assessment purposes. Most people will be able to recover at home.
great,
But that's
thank
why
you.
you're
That's
right.
fine.
Okay, thank you.
Oh, sorry.
Yeah.
Great, thanks.
Thanks, Irene. We'll go to Kate now from CBC.
Yeah, I think, now that we have a death, that's something that will be scary to some people. They're going to say, this makes it a little more real than just thinking of somebody being sick and recovering from the flu. What message do you have then to the people that do feel really anxious about the fact that, we have a death now?
Yeah, no, it's understandable that people will be very anxious. There is a bit of a misconception that other respiratory illnesses like influenza don't cause deaths. We do have a number of deaths a year due to influenza, even in our region. But besides that, COVID-19 is very much a concern for people. I think that really the only thing that we can do is to try to make sure that we provide the community with the information that we have about the risk in our community, about what's happening in terms of cases and now a death. And hopefully that information will make people feel like at least they have what they need in order to know what to do. So that ties back to Irene's previous question. I want to know the locations these people have been in. It doesn't matter anymore because we have so many cases and we have so many locations where people may have had casual contact. It is considered now broad, and everyone should do the same thing we would have told the casual contacts to do anyways. A couple of weeks ago, we would have said to them, self-monitor yourself for symptoms. That's what we did initially when we had a smaller number of locations. We had a smaller number of cases. We sent out letters, for example, to St. Mary's High School for people who may have been in casual contact, right? It was a low risk situation for these people, but we could identify the settings, because they were lower in number, but now it's everywhere. And so the advice to everywhere is monitor, for people that have been anywhere, really, is to monitor yourself for symptoms. And but I understand it's going to be concerning, and so that's we're going to try to keep providing that information. So, for example, yesterday I think it might have been you, Kate, that asked for information regarding who has been in ICU. So we are working on that, and by tomorrow we should be able to have not who at any one time is in ICU, but who has ever been in ICU, because one of the reasons the ICU number was difficult to get was because people come in and out of ICU sometimes. So, but going forward, we're going to say if you were ever in ICU, we're going to count that as having been in ICU, and then we're going to post that information along with the hospitalized information. So we're going to try to continue to provide more data and data that gives a good picture of what's happening in our community.
And you talk about people appreciating that information, and I think people have appreciated just how transparent the region's been. But we've received a few emails in the newsroom from people that would like to hear more updates. And has there been any talk about the region going to a daily update again, given that cases are increasing so quickly?
That's something probably I'll need to confer with people like Julie and others on our communications team. So we'll take that back.
Okay, that's it for me. Thank you very much.
Thank you, Kate. We'll go to Kevin Nielsen at Global. Kevin?
I'm good, thank you.
Hi, Kevin.
No questions, Kevin?
No.
Okay, thank you. Nicole, over to you at CTV.
Hi, guys. We've been speaking to the gentleman's family, and by all accounts, he was an active young individual who was well known in the community, in the arts and entertainment scene, someone that does not look like they have a pre-existing condition. What do you have to say? Because by all accounts, he does not fit the bill of someone you may think would pass away from this.
You mean someone who appears as if they're very healthy?
Yeah,
Yes.
because he was, just a month ago, active at work and whatnot.
Yeah, and by and large, any one of us can have medical conditions. It doesn't mean that we can't function really well and be very active otherwise. So it's true. I'm not going to confirm the identity of the person, but I can say it's true. When somebody, just because they have conditions doesn't mean that they're not functioning well. Doesn't mean they're really sick and bedridden or things like that. So I think what we're seeing across Canada now, as well in our region, is that this is showing that anyone can acquire this infection. Anyone can become seriously ill, and anyone can die. So yes, there are groups that if you have other medical conditions, you are at increased risk, but the risk of those complications and death apply to everyone. And that's why it's very important for everyone to be watching themselves for symptoms and to do whatever they can to contributing to reducing the spread in our community. I think it just highlights that this is a serious issue, and we need to continue to do everything we can.
What are going to be the guidelines, since now this is the first death? I'm sure the typical memorial and funeral cannot take place. So what happens for this individual's loved ones and those who want to celebrate his life?
Yeah, so the province, you may have seen on Saturday when the province issued that order to reduce the gatherings from 50 down to 5. They made an exception for funerals up to 10. So that what exactly will happen in cases of funerals for specific families, I can't say, but as much as possible, we understand funeral homes are trying to enable families to have these opportunities to I'm missing my words right now, but they're trying to. We know it's a very difficult time, and not being able to hold funerals like normally we would be able to is going to be even more difficult for families that have to go through this. So I think the funeral homes are trying to, as much as they can, to come up with different options, maybe virtual options, to try to allow at least people to connect. But we do know there are limits now, even for funerals. So up to 10 people across the province.
Okay, and wanted to check in on the status of Sunnyside. We understand that there's a staff member who's been tested positive, and other staff members, from what I understand. Can you just clarify that staff members must be checked out by public health before returning to work?
Okay, so the first thing I'll say is that we are testing a number of healthcare workers across the region, and I think this was also another a question that Kate brought up yesterday. We will be posting the number of healthcare workers overall, like the percentage of all those that have been tested positive. So we are focusing on that group, and we are going to be having more and more healthcare providers test positive. public health is not commenting on specific cases where there isn't a public health implication, such as an outbreak in a home. Because we think that's important, right? Those homes, long-term care homes, retirement homes, those are more vulnerable settings where people can become seriously ill, can pass away. So if there's a situation like an outbreak in a home, we will be reporting on that. We will be identifying where the outbreak is. But if there are healthcare workers that are being, tested and being found to be positive, but there isn't that public health implication at this time, then we're not identifying specific healthcare workers. We're not identifying those specific cases. So for Sunnyside, the best thing, if you have further questions, is just to go back to the region to ask questions about the case at Sunnyside. I believe they released something on their website.
Okay, I appreciate that. And there's one last question I'm asking on behalf of another reporter. That's
Sure.
okay. Has public health have conversations with RV park owners and approved accommodations for snowbirds to self-isolate at RV parks? Are you aware of that, or is that something that Mike Murray would handle?
I'm
I
not.
wonder if, sorry,
Yeah.
I was just going to suggest, Nicole, that these are good questions for tomorrow. We were simply wanting to give you an update about the death in the region.
Okay.
Thank you. Is that okay, Hsiu-Li?
Oh yeah, no, perfect. Yeah.
Okay. Is there any other questions? Okay. Well, once again, thank you all for joining us on such short notice. We thought it was important to reach out to you when we got this news, and we will be back on schedule tomorrow for a regular briefing at 11:30. Okay, take care, everyone.